morning, all. Today, as we have completed the secondary assessment, primary assessment for a child, now today what we'll see is the what are the common respiratory issues that you need to tackle in a child. So, respiratory issues are one of the most important reason why the child visits a doctor. So, that is one of the most important reason. So, you should understand what are the common respiratory disorders, how will you classify them, and how will you differentiate them, and what is the basic treatment that is required for that. I'm not going to tell a detailed treatment regarding how you recognize that it is primarily an upper respiratory issue, or whether it is a lower respiratory issue, or whether it is a lung parenchymal issue, or whether it's a related to breathing, whether it is due to disordered breathing pattern. So we are going to discuss that in the next 15 to 20 minutes. Okay, as you see here, primary your respiratory issues you can divide into four. You can have upper respiratory or upper airway related problems. Second one, lower respiratory related problems. So you can call it as obstruction or whatever it is. You can have lower respiratory issues, upper respiratory issues. Third one, you can have lung parenchymal problems. So lung, inside the lung parenchyma, there can be some problems. So what are the lung parenchymal problems? And fourth one, there can be disordered breathing pattern. So the breathing pattern of the child is not normal, but it might not be due to the lung issue. It is primarily due to some other problem. So the breathing is affected here, but it is due to the disordered breathing pattern. So primarily there is no lung issue, but due to some other problem, the breathing is affected. So that is disordered breathing pattern. So let's see what are the common disorders in this area. So upper airway obstruction, you have to remember three most common things are. One is something called as croup, C-R-O-U-P. It is otherwise called as laryngo tracheo bronchitis. Laryngotracheo bronchitis is otherwise called as croup, C-R-O-U-P. So this is one of the most common. It's again a viral infection. So basically it is inflammation of the larynx, trachea and bronchus. So all these things together we'll call it as croup. Laryngotracheo bronchitis, it is called as croup. It is commonly caused by an viral infection. So that is one of the most common issue by which the child will come. As I told before itself, what is the clinical features when you have a upper respiratory obstruction? You have more of a stridor, pooling of saliva in the upper limb. There is no clearing of saliva clearly, and there is a stridor. So stridor is an abnormal sound. It can be an inspiratory stridor. So stridor is what you need to see when the child is having croup. Lot of secretion. The age groups will be somewhere around 6 months to 2 years. So 1.5 years. That is the peak time where the child will present with croup. So croup is otherwise called as laryngotracheobronchitis. So the child will come with everything started with the small upper respiratory. Now the mother is telling that the child's sound is not good. The tone of the sound have changed because larynx is the organ what you need to produce the sound. So the larynx has got affected. So the sound production is not normal. So laryngotracheobronchitis. So there will be a lot of pooling of secretions. Everything will be there. So we have to understand that 6 months to 1.5 years, that is the peaking time for this croup, and it is a viral infection. So there is no role for your antibiotic. Only thing what has proven benefit is one is nebulized epinephrine. So you can give nebulized epinephrine and corticosteroids. So these are the only two things that will help the child to decrease the inflammation. What are all those two things? One is corticosteroids and epinephrine. So these are the things that you need to remember. So that is regarding your first upper airway obstruction issue, that is croup. So next one, what you have to remember is anaphylaxis. We have already discussed anaphylaxis. So remember that anaphylaxis that again can come with airway, sudden airway edema, and they can come with stridor. So the drug of choice is what? Epinephrine. But you can have nebulizations also, and you can give IM epinephrine, or you can start with IV preparation. Already we have discussed. and very rarely you can give antihistamines like corticosteroids. When it is not an anaphylaxis, whether it's just a mild allergic reaction, you can think of giving antihistamines like cetirizine or avil chlorpheniramine maleate and corticosteroids. So that is your anaphylaxis. So that is the second upper airway obstruction. So one important thing that you need to remember, whatever be the case of airway issue, you need to remember position to maintain a patent airway. So you don't forget that. You need to maintain a patent airway, suction whenever it is needed, and you should have a continuous cardiac and a pulse oximetry monitoring. So that has to be done. So it is always the basics. You remember those basics correct. So anaphylaxis, croup we have done, and next one is the foreign body obstruction. So foreign body obstruction, what will be the history? Sudden onset of breathlessness. The child was playing well. Now suddenly the child has become breathless. So you have to, the child has become cyanosed. Always consider a foreign body obstruction. So small child, what you have to do? You have to take the child on your hand, give him back blows, and you have to give chest compressions also. Back blows and chest compression, and by that we are trying to get the foreign body out. And if it's a larger kid, you can do for the Heimlich maneuver. So these are the things that you need to remember. So foreign body obstruction, always make sure that airway should be made clear either by giving back blows or chest compression or Heimlich maneuver. So that is your three most common. I am not discussing everything. This is the three most common upper airway obstruction issue in a child. One is croup. The child will come with fever, running nose, sound change, and all those things. The treatment is epinephrine nebulized and corticosteroid, then anaphylaxis, then you can have foreign body obstruction. So these are the three upper respiratory. Remember Strider. Now when you come to lower respiratory, the most common one is asthma. The most common one is asthma, and there is another entity called as bronchiolitis. It is again similar, it is again for a smaller child. The asthma can happen for any age group, but bronchiolitis affects a smaller age group, again somewhere around 6 months to 1.5 years. So bronchiolitis, they will come with lot of secretions. The mothers will start, there is something in the chest that is not coming out. I am hearing some gurgling sound inside the chest. There is some sound that I am able to hear, but the child is having some breathing difficulty and all. Again, it is a viral infection. So that is the next thing that you need to remember. Bronchiolitis is again a viral infection. Only thing that is going to help you is somewhat of suctioning out of secretion and maybe a bronchodilator if there is wheeze. So otherwise, there is no role for any antibiotics or any steroids. So again, here what you will see is wheeze. So lower respiratory, you will have wheeze. So upper respiratory, you will have stridor. Lower respiratory, you will have wheeze. Two things that you need to remember is asthma and bronchiolitis. Asthma, just like you treat for any asthma, you need to give for albuterol is salbutamol only. Albuterol is salbutamol. So in one US they will say one thing, and in UK they will say salbutamol. That's the only difference. So both are the same drug. So you can give albuterol or salbutamol, both the same drug with ipratropium. Steroids, depending upon how difficult, how much bad is the child, depending upon that you can think of nebulization and magnesium sulfate and terbutaline. So these are the drugs. We will discuss asthma in detail. That's what I am not going to in depth regarding asthma here, that we will discuss as a topic as such. So asthma and bronchiolitis, you need to remember wheeze. Upper respiratory, you remember it as stridor. Now we come to the next one, that is the lung tissue. So we have come to the upper airway, lower airway, and we are going to the lung tissue. So lung tissue, we can have two issues. You can have fluid overload states, and we can call it as pulmonary edema. So pulmonary edema is not very common in child, but remember that if the child is having already some cardiac issues, already the child had undergone some surgeries, cyanosis is already there. So pulmonary edema can be one of the reasons why the child is breathless now, and the most common one is pneumonia. So both of them, what will have, what finding you will have, you can get rales or crepitations. So that is how you need to differentiate. So here you can hear stridor, here it will be wheeze, and in pulmonary edema and pneumonia you will be able to hear crepitations. So basically pulmonary edema, how you need to treat pulmonary edema, basically you have to remove the fluid from the body. So first thing, you need to support the airway with giving a good positive pressure ventilation. Then diuretics, that is most importantly, you can give diuretics and remove the fluid, excess fluid from the body. So that is regarding pulmonary edema. And pneumonia, what is the basic treatment? You have to treat the ABC, there is no doubt. You have to give oxygen, all those things. So the primary treatment will be, if it's a bacterial pneumonia that you suspect, the primary treatment will be what? Antibiotics. So that is in general. I am not going to discuss in detail regarding each of these things, just to understand what are the common respiratory issues in the child. So the most common respiratory issues we can divide into 4 types. First is upper respiratory obstruction, lower respiratory obstruction, lung parenchymal issue, and disordered breathing pattern. So we have, that is the lung tissue disease, and finally we have disordered work of breathing. See, the most common disordered work of breathing, what you will be seeing here is post seizure, post ictal. The child had a seizure. So the child had a seizure and the child has become suddenly drowsy, and the child can go into a respiratory arrest. So one most common thing that you need to remember is seizure, post ictal. So the child might have bradypnea. So again, it can be due to increased raised ICP. So the raised ICP, what will do? The raised ICP will start affecting your respiratory centers which is inside the brain. So the pressure will start getting affected the respiratory centers. So as a result, what will happen? The brain will start herniating, and as a result, the patient will stop breathing. So that is a disordered breathing. The patient is not breathing properly. Usually they will have bradypnea, and there are different types of breathing. You have heard something called a Chain-Stokes breathing, and you have Biot's breathing. There are different breathing patterns. Remember that if there is a disordered breathing pattern, whichever that is not normal, you can call it as a disordered breathing pattern. So when you examine, there is no upper airway obstruction, there is no lower airway obstruction, the chest is clear otherwise. You have removed a lung parenchymal disorder also. But the patient is having some breathing trouble. So always remember, whether it is a disorder work of breathing, the common reason for disorder work of breathing, as I told, is one is seizure, and the next one is raised ICP. So what you have to do in raised ICP? You have to decrease the intracranial pressure, and you have to prevent secondary brain damage. We have already discussed this. Avoid hypoxia, avoid hypercarbia, and avoid hypothermia. So yeah, these all things you need to avoid. And the patient can have some neuromuscular dystrophy. So suppose the child is having some diaphragmatic palsy or a neuromuscular dystrophy. Because of that, the phrenic nerve that which is supplying the diaphragm, so the diaphragm is not working well. So as a result, the patient is not breathing well. Or as a result, there is no proper supply to the muscles that is controlling the respiration, the child have disordered breathing. So that is what, there is nothing to do with the lung, but it is due to the breathing pattern of the child. So the breathing pattern or the work of breathing, disordered work of breathing, what you can see is in raised ICP. One is raised ICP, the second one is what, as I told, is neuromuscular issues. And you can have poisonings. There can be certain poisoning. The child had accidentally intaken some drug like opioids, or opioids is what, morphine, so like sort of a codeine syrup was available previously, accidental ingestion. So accidental ingestion also, this toxicology related issues also, they can go for respiratory work of breathing related disorder work of breathing. So that is what you need to remember. So you can have 4 things. First one, upper airway, you remember that it is, you can identify with the help of the stridor. You can have either croup, you can have foreign body obstruction or anaphylaxis. And in lower down, we have the lower respiratory. You have 2 things that you can, common things, that's what I am telling is, one is bronchiolitis and other one is asthma. And when we come to the lung parenchymal disorders, you can have pneumonia and pulmonary edema. And when you come to disorders work of breathing, it can be either due to raised ICP, post seizure, or it can be a neuromuscular dysfunction, or it can be due to an overdose. So these are the things that you need to remember. So these are the common respiratory issues that you need to tackle. So when you get a child, so you need to differentiate where exactly the problem is. So whether it is in the lung parenchyma, and the treatment should be focused towards that. So it is not to give nebulization for all the patients that is coming with breathing difficulty. You need to identify where is the problem. There is no point in giving a nebulization for a foreign body obstruction. You need to remove that foreign body obstruction, then only it is going to improve. So disorder work of breathing, what is the point in giving a nebulization? So you need to treat the cause why the child is having a disorder work of breathing. So similarly, you need to identify, evaluate and treat. So you have to identify where the problem is, whether it is in the upper airway. So upper airway clues I have told, it is stridor. Lower airway, it can be wheeze. Lung disorders can be rales. And if anything, all these things are not there, but still the child is not breathing well, it is due to disordered work of breathing. So that is pretty simple algorithm that you can remember these things. Each one of this we will discuss later when we discuss regarding respiratory emergencies, we will discuss each one of these differential diagnosis. But for the time being, just you know what is the basic treatment of each of this. So epinephrine we have already said for anaphylaxis. Like that, for croup we have to give nebulized epinephrine and steroids, and for foreign body obstruction you have to remove the obstruction. For asthma you need to give nebulizations and steroids if indicated. Bronchiolitis, just bronchodilators is the only thing that is going to help. And disorder work of breathing, you have to treat the cause why the child is having a disorder work of breathing. Pulmonary edema, you need to give positive pressure ventilation and diuretics. And pneumonia, you need to give basically what you need to give, treat the IV antibiotics. So that is in a nutshell regarding your respiratory disorders. Okay, thank you.